Hello, and welcome to our Professionals Continence workshop for secondary-aged pupils. The presentation will focus on what can cause problems with continence, and how we can all support young people with overcoming these challenges. The aim of this workshop is to ensure all school staff become more aware of continence issues that secondary school-aged pupils could face, and how to support them. The objectives are to consider strategies of how to support your pupils and their parents or carers to manage their toileting needs, and to also consider how you can reduce worries around their continence issues. Some secondary-aged pupils will have the occasional toileting accident. This may be because of either a medical, physical, or psychological need. To put this into context, approximately 750,000 children in the UK, between ages 5 and 16, will need some toileting support. This equates to one pupil in every 2 classes at secondary school. Everyone develops at different rates, and some may need extra support and interventions to help manage their individual continence needs. Individuals with a medical, physical, or psychological need, or a learning disability, may also experience continence difficulties. Remember, incontinence is not uncommon, and it is not deliberate. If a pupil does have an accident, keep calm, and do not get annoyed with them. Be as discreet as possible whilst dealing with the issue, so as not to add to their embarrassment. ERIC is a children's bowel and bladder charity, so if you feel your school is struggling to deal with toileting incidents, it may be useful to read their Help at School guidance for further information. Pupils will achieve independence with self-care, at varying levels, depending on cognitive, physical, emotional, social, and cultural factors. It is important to remember that their understanding and social awareness may impact and possibly delay their toilet training, rather than it being a problem with the bladder or bowel. Individuals with physical or learning needs may take longer to become dry, and this could be due to the bladder and bowel maturity. Continence is the ability to consciously control the discharge of urine or a bowel movement. It's important to remember that as we all start our lives, none of us have this control. Just as pupils don't learn in the same way or at the same pace, they don't all develop continence at the same age. It's estimated that 1 in 12 children in the UK, between the ages of 5 and 16, experience continence problems. The urinary system is how the body eliminates some of its waste. Before leaving the body, the waste travels through the urinary tract. Most of us have got 2 kidneys. They filter our blood and take out the waste products. The bean-shaped kidneys filter the waste products from the bloodstream and make urine. Long thin tubes called ureters carry the urine down from the kidneys to our bladder. The bladder is an expandable, muscular sac in the lower abdomen area. It stores urine until it is passed out of the body through the urethra. When the bladder is about half full, a message is sent to the brain to go to the toilet. The urethra is a single, tube-like structure, which allows urine to exit from the bladder. Between the bladder and the urethra is a muscle called a sphincter muscle. This muscle prevents urine from leaving the bladder until you go to the toilet. When you relax, the muscle allows the urine to flow out. The bladder is a muscular sac. Like any other muscle, the bladder needs to be exercised to keep fit. By not drinking enough, pupils can reduce their bladder capacity. This reduced capacity can lead to continued wetting. Having access to water throughout the school day is a major factor in supporting a healthy bladder. Some individuals may need prompting to have a drink to help strengthen their bladder. Pupils should also be reminded to access the toilet at break and lunch times. Daytime wetting is known as diurnal enuresis. This affects 1 in 75 children over the age of 5 years old. However, individuals with additional needs may be affected more due to physical or medical needs. Nighttime wetting is known as nocturnal enuresis. The reasons for nighttime wetting are not fully understood. It is not because of poor toilet training or laziness, and can be because of more than one cause. As previously mentioned, there can be a number of reasons that affect a pupil's continence. One factor is not drinking enough, or drinking the wrong types of fluid. Cutting back on drinks in a day doesn't help resolve wetting. The bladder adjusts to holding less fluid, and therefore holds less before the need to empty occurs. Also, urine can become more concentrated, which irritates the bladder muscle. Certain drinks can increase urine production. It is important to reduce drinks which contain caffeine. Caffeine is a diuretic which makes you urinate more frequently. Examples of drinks that contain caffeine are tea, coffee, and Coke. Most fizzy drinks can also irritate the bladder. Pupils will vary with how long they take to become reliably dry during the day after potty training. It is not unusual for younger children to be engrossed in what they are doing and not listen to the signal that they need to urinate. Some pupils may delay in emptying their bladder. They may have a lack of awareness about their bladder being full, or a lack of ability to hold on until getting to the toilet. If you have a young person in your class that you are aware of, who tends to get engrossed in certain activities, a simple reminder for them to go to the toilet before going out to break may be all that is needed. An overactive bladder is when there is a need for frequent urination, or an urgent need to get to the toilet quickly. Going to the toilet 8 or more times a day would be considered frequent. This is when there is an uncontrolled contraction of the bladder wall, and the bladder contracts before it's full. It appears to be more common in girls, and is often linked to urinary tract infections. With an overactive bladder, pupils will have a smaller bladder capacity than usual, due to the frequent need to urinate. Pupils will often try to stop the very strong feeling that they need to urinate by squatting, sitting on an ankle, or standing on tiptoes, which can result in wet pants. An overactive bladder can present as nighttime wetting, as frequently going to the toilet to remain dry during the day goes unnoticed. Strengthening the bladder by drinking more during the day has a positive effect on nighttime wetting, by building the bladder's capacity to hold more fluid. Small bladder capacity can be linked with bladder irritability, or an overactive bladder. This is due to the frequent emptying of the bladder, so that it doesn't hold as much as it should. Again, not drinking enough fluids has a negative effect, so we actively encourage drinking the suggested amount of fluid each day, to help promote a healthy bladder. Having constipation can affect continence, as the bowel can press upon the bladder, giving the sensation of frequently needing to urinate. A frequent urge to urinate can also be the result of anxiety or stress. When the anxiety or stress is resolved, the problem can often disappear. Some individuals who wet the bed can lack the nighttime hormone called vasopressin. This hormone works on the kidneys and slows down the production of urine at night. If there is a lack of the hormone, it can mean that the individual makes more urine overnight than the bladder can hold. Pupils can take an artificial form of the vasopressin hormone in a medication called desmopressin. Indications that a pupil might not have enough vasopressin are that wetting occurs every night. The wetting can occur early in the night, and often more than once. Another indicator if there is not enough vasopressin is that there are consistently large patches of urine which is light in color and in smell. Individuals with physical or learning needs can take longer to become dry. However, some children and teenagers may never be bowel and bladder ready, and will need support from continence products or health services. Urinary incontinence occurs in 3 to 4% of teenagers, and around 1% suffer from bowel incontinence. Continence is among the most common pediatric health problem. It's commonly believed that continence problems resolve with age in all individuals. However, some children and teenagers may never be bowel and bladder ready and will need support from continence products or health services. When you start to think about management of continence issues, it's important to establish what type of problem it is. There are different types of continence issues. Stress incontinence, which occurs when the bladder muscles are put under stress due to pressure. Leakage can also occur when the pupil coughs or exercises. Urge incontinence is the overwhelming urge to urinate. Leakage may occur before the pupils reaches the bathroom. Nocturnal enuresis is when involuntary urine leakage happens during the night, or when the urge to urinate wakes the child up. These types of incontinence can be caused by many factors such as a fluctuation in hormone levels, conditions that cause nerve damage, such as multiple sclerosis or diabetes, a bladder infection, injury, or frequent participation in high-impact sport. Encourage teenagers to keep a track of their own fluid input and urinary output. This could be via paper diary or on a phone app. Parents, carers, and trusted adults can keep a track of input and output if needed. The UR app was created with the support of ERIC, the Children's Bladder and Bowel Charity, to provide a tracking and reminder service for continence. This app is free to use. Constipation is when there is difficulty, or a delay, in passing stool. If stool builds up in the bowel, it can become large, hard, and painful to pass. This affects around 30% of young people. The description of constipation taken from Eric's continence assessment form states that the normal range is anything from 3 times a day to 3 times a week. However, most will pass stool every day. Children and young people should be encouraged to poo at least every other day. This equates to 4 times a week. This slide shows the difference between a healthy bowel on the left and a constipated bowel on the right. Pupils may avoid going to the toilet to pass their stool. They start to hold in stools by tightening the muscles around the anus to keep it closed and put off the urge to pass stool. Delay in passing waste leads to large hard stools, which can stretch the anus and sometimes tear it. The pupil will then try not to have a bowel movement, as it's too painful, and they delay passing stools even further. The anus can become overstretched, and the pupil may no longer feel the sensation of needing to go to the toilet. Although stool may be initially hard and pellet-like, it can then later become very runny and mark the individual's pants. This happens because the stool further up the bowel has not yet solidified and seeps around the blockage. Remember, the pupil is not soiling deliberately. If a pupil is having frequent accidents at school, make sure that their clothing is easy for them to remove. Fiddly buttons and belts might slow down the process, and therefore impact on the individual getting onto the toilet in time. Encourage pupils to have 6 to 8 water-based drinks a day. Remind pupils to access the toilet at appropriate times. Remember, some pupils may need to go during lessons too. Some pupils may need to have access to a toilet pass that they can use to go to the toilet whenever they need to. Good communication between parents and school is crucial. Encourage parents to share with you any continence concerns that they have. If as a school you are not aware that there is a problem, then you can't help support them. Parents can bring in a change of clothes for their child if they are having accidents, so that it can be dealt with swiftly and therefore have minimal impact on the young person's education. If you feel that you or your parents and carers need more information to help support young people within the education setting, the ERIC website offers further advice and strategies to support this. Links are available on the webpage under this video. As mentioned previously in this presentation, fluid intake has a huge impact on continence. Drinking can often feel like a huge task to some pupils, and it can be challenging for adults to encourage drinking throughout the day. There are lots of ways to encourage fluid intake. There are some suggestions on the slide that we offer to parents, carers, and school staff. Some pupils may have a dislike of unflavored water, so a small amount of squash diluted down can make a difference. The chart on the right-hand side gives an indication of how much fluid a pupil should be consuming each day. It's important to remember that cutting back on drinks in the day doesn't help resolve continence issues. This is due to the bladder adjusting to less fluid, and therefore it will hold less urine before the need to empty occurs. Sensory information is received from our sensory organs and gives us information about our world. The sensory systems includes touch, vestibular, which relates to balance, proprioception, which is connected to body position, vision, hearing, taste, and smell. Other sensory information is also received from our internal body organs, including bowel and bladder awareness, which affects the ability to learn continence. This ability is called interoception. Our responses to sensory information may be affected by a range of factors, including our previous sensory experiences. It can also relate to how alert or stressed we are, and our maturity. Think about each sense, and what this may mean for a child or young person and their continence. Also think of the toilet environment in schools, and how this can impact on toileting. The sense of touch can relate to where a pupil could be sensitive to hard toilet seats. They could also dislike the feeling of wet or dry tissue, struggle with having stool or urine on their skin, or the splashing of water could cause them distress. The pupil may not notice if they are wet or soiled, and may enjoy playing with stool. Some pupils may find the smells in bathrooms and toilets unpleasant. Toiletries or cleaning products could be too strong, or they may seek out strong smells and sniff stool. Some pupils may struggle with the sound of the toilet flush or the dryers. The echo within the toilet could be too much. They could seek out loud sounds and be distracted by the flush or the echo, and then not use the toilet at all. Bright lights and reflections in the toilet could cause distraction, and be confusing in the toilet environment. Some pupils could struggle to distinguish what to focus on in the toilet. Many individuals with sensory needs struggle with drinking water or eating fruits and vegetables that can help support a healthy bladder and bowel. Proprioception could be where a pupil's body awareness may be increased with more sensation. In particular, this could relate to the hard seat and the space around the toilet being open. They may be uncomfortable and in pain from trying to sit on the toilet. Vestibular, which relates to balance, could impact a pupil by making them feel unsteady on the toilet. Their feet may dangle and not touch the floor, which makes them feel unbalanced. The open spaces within the environment may also affect their senses. The signals from the bladder and bowel can be explained like a whisper, and therefore can be missed easily. Pupils may seek the full bladder and bowel sensation, and feel it as a positive stimuli. Reactions to sensation can be affected by stress, previous memories, and experiences. If you have a particular pupil that is experiencing difficulties accessing the toilet within an educational setting, schools may need to offer a sensory screen. Thank you for watching the Professionals Workshop presentation regarding secondary-aged pupils' continence. We hope that it was useful and that it will help you to support your young people at school. The opportunity to discuss any other health and well-being issues is always available with Connect for Health. Please do not hesitate to contact our service on the details provided. You can also scan the QR code on the slide now to visit our website and download a referral form. Alternatively, the relevant links and details will be on the webpage below this video.